Debbie.
Hi.
My name is Noah. I'm an occupational therapy student. I'll be working with you today.
Okay.
Could you tell me your first and last name
Debbie Higgins,
and then your date of birth?
February 7th, 1979.
Perfect. That's what I'm tracking with. Okay, so I know you've had multiple sclerosis for a pretty long time. Now, could you tell me a little bit about that?
Yeah, I've had it for about 10 years, and it's just recently getting worse. I've had quite a few falls, and I just cramp up really bad, and my arms tend to get really stiff, and my legs get stiff.
Okay.
And yeah, I just have a lot of pain and fatigue.
I'm sorry to hear that.
Yeah.
And then can you tell me like what a normal day looks like for you? Like when do you start doing your activities for the day?
In the morning.
In the morning?
Yeah, I typically have to do them in the morning because I get too tired.
Okay. Do you have anyone at home to help you with those activities when you get tired?
My husband and my kid.
Okay, cool. And then what kinds of activities do you like to do around the home?
I really like to read and watch TV. That's
Okay.
mainly what I do throughout my day. But if I'm feeling up to it, I really like to play Battleship with my kid.
Oh, that's so sweet.
Yeah.
Cool. And then do you do anything else like activities such as like cooking for your family or something
Yeah,
like that?
I try and cook for my family as much as possible. I cook all the meals.
That's awesome to hear.
Yeah.
Cool. And I see you're in a wheelchair right now. Do you have any other equipment? Adapt from like a walker or a cane that you use?
Yeah, I have a cane and a walker that I use.
Cool. Do you use one more than the other?
I use the walker more.
Okay, cool. That makes sense. A little bit more support there.
Yeah.
Cool. And then another thing, I emailed you and your family like a pain scale assessment. Were you able to fill that out and bring it with you?
Yeah, I have it right here.
Cool. I'll go ahead and go over that with you. So we call this a PES, which just means pain efficiency scale. FX scale, my bad. So like you said, the self-assessment scale that you go ahead and score as you did, according to best evidence, is the best to use for quality of life for multiple sclerosis patients. So that's why I went ahead and sent it to you. So I appreciate you filling that out.
You're welcome.
So it looks like if we add up the scores of these 6 items, you scored a 23 out of 30, which shows that you do experience unpleasant sensory symptoms as a result of your MS, decreasing your quality of life.
Yeah.
So let's go ahead and go over these items, like where you're having most trouble. So your mood, just a little bit affected. That's good to see. I mean, it's definitely hard when you're kind of on the decline, but we're going to help fix that. We're going to stay at a steady line. We're going to get back to doing those activities.
Sounds good.
And then ability to move and rock around. Yeah. Is it your lower extremities what's mainly affecting your ability to? Okay. And then do you have any kind of pain there?
I have a lot of pain in my legs.
Okay. Well, I'll be happy to tell you we'll be addressing that, okay?
Sounds good.
Let's get through this real quick, and then I'll go over that. And then sleep, is that also kind of limited by pain? Is that why you? Okay. Cool. And then working, recreation activities, just that increased stiffness, and then decreasing your enjoyment of life. Well, I'm sorry to see that, but I'm glad you came here so we can address a lot of these things, okay?
Me too.
So what I kind of want to go towards next to get you back to doing activities, I assume you want to be more independent and do more?
Yeah.
Okay, cool. So our next item of business, if you're up for it, is to do what we call a modified Ashworth assessment or exam. So that scale, there you go. So basically, all the increased like tone you're having in your legs and your arm, we're going to go ahead and identify where that buildup is, because that's causing a lot of your fatigue, which is leading to your pain.
Okay.
Basically, your muscles are in this constant state of contraction. As you've heard, there's like these misfiring of nerves. So your legs are just going into that extension. You can't bend them. We're going to work the opposite side of that muscle, stretch them out, or build those up and then stretch out your overactive muscles so that we can get rid of that excited muscle and limit that fatigue that's coming from that. So you'll feel free. So you won't have any more fatigue or pain. And so that assessment is just the best evidence to use to determine those spastic, which is the high tone joints, and start working on that, okay? Okay, Debbie, we're gonna take some vitals now. How does that sound?
Sounds good.
Okay, I'm gonna go ahead and use your right arm here because your left arm be a little spastic, and we don't want any contraction while we're doing this. Okay, so we get an accurate reading. So I'm going to be putting this around your arm. This is just a blood pressure cuff. Do you know if you normally run high or low?
It varies, but typically lower.
Okay, cool. Okay, so we'll get started. Is it okay if I touch you?
Mm-hmm.
Okay, I'm gonna find your artery. There you are. There. Sleeve up actually real quick.
It's those guns.
You need to stop working out, Debbie. Yeah. Is that okay?
Mm-hmm.
When I inflate it, it's going to get pretty tight, but it's going to dissipate pretty quickly. But if it's unbearable, just let me know and I'll deflate it.
Okay.
Okay. There we go. Got about 112/66. Does that sound about normal?
Mm-hmm.
Okay.
Yep.
Let's get this guy off here. Still feeling okay?
Yep, feeling good.
I'm going to write this down real quick. And that is also an okay blood pressure to have. It's a little bit low, but like you said, you ran a little bit low. But that's totally normal. And then I'm going to, you care if I touch your wrist at all? Does that weird you out? Okay. So now I'm going to take your heart rate. So I'm going to find your radial artery. Just relax. Okay, perfect. So I got about 70 for your heart rate. Does that sound about right?
Mm-hmm.
Okay. And your resting heart and your resting respiratory rate was 14, which is all within normal. And the last thing I'm going to have you do, vitals, is just stick your finger into here, okay? So I'll have you extend your second digit. And it's on here and just relax. Yep, extend your hands out. Perfect. Fingers. So you also have 70, about 70, just like we found before, and then your oxygen is at 99. So everything looks great.
Perfect.
Okay, let's go ahead and head back to the other room, and we'll start looking at some other stuff. Okay.
Okay.
Cool. Okay, Debbie, now we're going to work on the modified Ashworth scale. Okay?
Okay.
So, like I said, we're going to test for that increased tone in your muscle. So, what's causing it to straighten or contract doesn't allow that much movement, and the pain as well. So, I'm going to go ahead and demonstrate on your upper extremities. I'm going to demonstrate to you on your right, and then I'm going to do the assessment on your left arm, because that's where you're having the trouble. Then I'm going to do both lower extremities and tell you the scores of that. So for your upper extremity, we're going to be working on your shoulder. So since we're having tightness in doing the flexing motion, shoulder flexion looks like this. So I'm going to have you come down in 1 second. I'm going to do it, passively. Come down, and then I'm going to see if there's any catch in that muscle. Then we're going to go to the elbow. We're going to start here, come here. Wrist, we're going to do this, come like that. We're going to do mass MCP finger flexion, so your knuckles, they're coming in like this, then they're coming out. The thumb, coming in like this, out like that. So I want to make sure we get this whole upper extremity, see if there's any extra muscle tone that you need to address.
Okay.
Your lower extremities, I'm not going to demonstrate, I'm just going to do it because with more demonstrations limits the reliability of this assessment. And I want you to get the best results, okay?
Okay.
So with your leg, I'm going to start an extension and then move up into flexion. So with your hip, we're going to move up. Your knee, I'm going to have your knee bent like this, and then we're going to go into flexion. Ankle, this is currently an extension because you're showing the extensor tone, and we're going to bring it to plantar or dorsiflexion, which is bringing your toe forward like this. Okay?
Mm-hmm.
This is just a list of your scores, which I'll go through afterwards. Okay. So that's for now. Okay. So we're going to start with your shoulder flexion, which is primarily your pec muscles, and then we're going to see if there's any tone. Okay. I did not feel any tone there. That's awesome. Now we're going to start your bicep muscles, elbow flexors. And just good. It was about a 2 there, so you showed tension about half of that movement. So that's one we can probably address. And the wrist, start flexion, and then we're going to go into extension. Also about a 2. Fingers, flexion. Okay, and that was towards the end of the movement, so that'll be a 1+. Thumb, start flexion, and then we're going to bring it to extension. Okay. And then there's actually 1 because it started with some tension, but then released as we got further. Did you experience any pain with that?
Mm-mm.
Okay. Are you feeling tired at all right now?
Not yet.
Okay, cool. Just keep me updated because I don't want to hurt you at all. Okay, now with the leg, like I said, we're going to start an extension. I'm going to position my body so that I am in the best leverage possible. Okay, we're going to go straight into extension, okay? No increased tone there. Good. So then we're going to come back up and they're going to be bending. Okay, ready?
Mm-hmm.
Ooh, got some crepitus right there. Are you okay?
Yeah.
Okay. That was about a 3. For most of your range, I felt like I was pushing against it, so it's not quite to the point where it was full, but it was pretty close, okay? Now your ankle, start in extension. That was about a 2. Now we'll switch sides. Actually start down here, make sure you can see this. One. Okay. No tone, increased tone there. Okay, come back up. Okay. Also about a 3. And then we're going to work on this plantar flexion. About a 2, 50% of that movement. Okay. Ooh. Great job, by the way. You still feeling okay?
Mm-hmm.
Perfect. Okay, so I kind of told you how we were scoring. So a 0 means that there's no problem at all. So like your shoulder and your hip had no increased tone, which is great. So you can start that movement, but your increased tone is coming from your more distal limbs. So like the limbs are further away. So like your elbow and your wrist, your fingers and your thumb. So that's what we're going to be addressing, and same with the hip. So when I talk about our HEP, I'm going to give you exercises and stretching that are going to address your elbow flexion and wrist flexion, since those are your highest scores. And when we get to the lower extremity, your lower limb, I'm going to address your knee flexion and your ankle flexion. Okay?
Okay.
Makes sense?
Yep.
Cool. So hopefully we can start on that and with some of that pain and fatigue you're experiencing.
Sounds great.
Okay?
Yep.
Awesome. So we went ahead and wheeled out here. We're going to start doing the modified Barthel Index. So this assessment is both reliable and valid. It's the best evidence to use for assessing an individual with a neuromuscular disorder for self-care and items such as that. So I know you can walk just fine. However, I know for like longer distances, you like to utilize the wheelchair. And I feel like we can get into a lot of your other activities, such as you used to like to go hiking, if we can utilize the wheelchair. So I'm going to have you go ahead and wheel yourself best of your ability to that, around that stool. We're going to come back in here. You're going to go past the bed, go into the under the table, and position yourself whenever you're ready. Good. I like how you utilize the right side there. Yeah, it's kind of tight. Good job. Still feeling okay?
Yep, just getting a little tired.
Just let me know if you can't go any longer.
Oh, I can do it.
You can do it?
Yeah.
She's motivated. Okay, I'm ready to take her right into this door. Great job. So once we're through this door, great job maneuvering. Watch the fingers. You did. We're going to go to that table. Just position yourself in there like a chair, and then we're going to back out, and then just once you reverse wheel yourself to this bed.
Okay.
Good job looking over that shoulder. Okay. Now let's see that parallel parking skills.
None.
None. Good. Okay, Debbie, so the next part of our assessment is what we call a transfer, specifically a sit-to-stand transfer, which is you just go to the edge of your seat, standing up, and you're going to sit down on the bed. And then we're going to lay down the bed, and then we're going to have you get out of the bed and back to the wheelchair. I just want to simulate how you do this at home so I can get a better idea of what I'm looking for, okay?
Okay.
So I'll have you, since your locks are braced, locks are braced, we're going to have you just stand up to your walker and then transition to the bed. And I'll be here just for assist, okay? Good. Feel better? Perfect. Feel yourself with descent. Are you okay like that? Okay, great. And whenever you've watch your breath. Come ahead and let's see how you get out of the bed. Really use that right arm. And your caregiver will also be here to help you with the walker, which is why I'm bringing that towards you. And then just like how you got in the wheelchair. Use your feet forward anymore. There you go. Good. I like how you felt the back of that chair with your legs. Great descent. Wonderful. Okay. Are you still feeling okay?
Mm-hmm. Yep.
Now I want to try moving around your bathroom. How does that sound?
Sounds good.
Okay, Debbie, now we're just going to walk as far as you can go. So take as many rest breaks as you need, okay?
Okay.
And bring this wheelchair behind us so in case you get tired, we have a place to sit. Great, yep. Really utilizing those upper extremities. Great job. Still doing okay?
Yeah, I'm getting a little tired.
Okay. So let's go ahead and stop. I'm going to sit down. I'll take a rest break, okay?
Okay.
Yeah. I can tell. Let me go ahead and lock this wheelchair before we sit down, okay? And so that wheelchair at the back of your legs. Use the upright hand to go and sit down. Okay. Just take a minute and then we're going to try some stairs to go for it, okay?
Okay.
Okay, Debbie, now we're going to work on some stairs. Is that okay with you?
Yep.
Okay, so do you at home, for your one step, do you use an assist device like a walker to get up?
Yes.
Okay, I would like you to demonstrate that for me. Just going to this one step and then turning around and coming back down with your walker, okay?
Okay.
Whenever you're ready, go ahead and start. I'll be back here for support. Great job. We're gonna work on some upper body dressing. So if you can, I'm gonna have you put that shirt on how you would normally put it on, and then afterwards, I'm gonna have you take it off, okay?
Okay.
So whenever you're ready, go ahead and put your shirt on. Perfect. And then, can you button buttons for me?
I don't button buttons.
Okay. Do you want to you want to work on getting your buttons buttoned?
Not really.
Not really? Okay.
No. I like it the way it is.
You like the way it is?
Mhm.
Okay, that's fair. That's understandable. Okay, go ahead and take your shirt off now. Good job. Our next assessment is going to be doing some hygiene and grooming. So if you can, we're going to go up to the sink here. Just let me know if you need to take a rest break. Okay. Now, because I want to be able to support yourself on the sink, and the walker's kind of in the way of that right now, I'm going to have you move your walker to the side, preferably to your left. And right here. Kind of bring up your feet next to that sink for stability. So you kind of lock out those legs. Good. Okay. Now I'm going to have you grab that toothbrush and just brush your teeth for a little bit. Just want to see you be able to do it. You can use your right hand. Water. Perfect. Great job. That's your stability. Perfect. Looking great. you brush your hair. Wonderful. And the last thing I want you to do while we're standing up here, I just want to check your sensation for hot and cold. So I'm going to turn this on, and I want you to say if it's hot or cold, or if you feel the difference. I'm going to touch it real quick. Okay. Now go ahead with one hand. Is that hot or cold?
Cold.
Okay. Now with your right hand or left hand, let's say if it's right or cold. Or hot.
Hot.
Okay. Perfect. Okay, I'll bring this walk over here, and then we're gonna go to the toilet, okay? Okay, Debbie, so now we're gonna head over to the toilet, and we're just trying to simulate how you would normally use this at home. Nice job. Okay, and just simulate grabbing the toilet paper and then wiping. Perfect. And then whenever you're done, go ahead and stand back up and we'll get those pants back on. I like how you're using the right hand for stability. That's your stronger arm.
Yeah.
Great job. Okay, Debbie, next we're gonna go to the shower bench that you have. We're gonna sit down and you're gonna scoot yourself into the bath, and then we're gonna scoot yourself out of the bath and then head on out, okay?
Okay.
Just show me how you would do that. If you're getting tired, let me know so we can take a break.
Okay.
Reach back for that. Good. Good. Okay, and then show me how you get out. And then click it to you. Perfect. And then we're gonna push open that backspace. Awesome. Okay, Debbie, so I want to work on feeding. Just want to make sure everything's looking okay. So with this yogurt, I'm just going to have you bring it to your mouth. We're going to simulate these cups as being salt and pepper. So just pick it up, act like you're pouring something in there. And then for that Smartie over there, you're just going to cut it to make sure I know that you can cut your food, okay?
Okay.
So just go ahead and run through all your motions. Good. Great job. I can see you're getting a little tired. Your arm's starting to get a little
Yeah.
high tone, spastic again. Well, that was the last assessment, so we can go ahead and head back to the room and go over a few more things, okay? Okay, Debbie, we're gonna get started on your home exercises. How does that sound?
Sounds good.
Sounds good? Okay, cool. So just to preface, I chose your exercises based on what normal is for multiple sclerosis, as in what we call METs, which is just how much energy it takes you to perform activities, okay? So you fell into the range of 3 to 3.5, which is in the range of moderate intensity. Based on best evidence, that was what was recommended by your physician. And I kind of erred on the side of 3 to more centric, because I want you to get more reps in your movement instead of more intensity, so we can really relieve that spasticity, okay?
Okay.
Cool. And so for moderate, it was recommended between 2 to 3 times a day you'll be doing these activities. 2 to 3 times a week you'll be doing these activities once per day 2 times a day, 10 reps.
Okay.
Okay. And that's all in this sheet, so you don't have to remember that.
Good.
Cool. And then I chose the medium band exactly for that resistance reason. I want you to be able to get all the reps. And so if you need to get the reps, extend your hands out more. That's totally okay. I'm going to start shoulder length because that should give you a proper amount of resistance for this activity.
Okay.
Okay. Mm-hmm. And we'll adjust it as we need to based on your performance. Okay.
Okay. Sounds good.
So I'm going to actually have you do some warm-up exercises. So just to get your shoulders loose, I'm going to have you do some shoulder curls. So you'll just kind of keep your straight posture, kind of block your legs a little bit, sit up straight, and just roll your shoulders forward and back. Forward and back. So like I said, this is going to do 2 sets of 10. And you can just do a couple. I just want to show you these exercises.
Okay.
Okay. And our other warm-up exercise is just sitting forward, and we're going to have one arm bent, one arm straight. You're reaching past your midline like this. So I want you to, yep, just like that. So we'll go here and then transition. Transition. Good. Yeah, I'm just trying to get those joints to straighten just like that. Perfect. Okay, come ahead, relax. And you can also work up to these. It's a goal for me to have for you to be able to perform. Okay. So for our first exercise, we're going to do a straight arm raise. So you're going to do this on both sides, but I really want you to emphasize on the left side. So you're going to have let's say your right arm on your left knee, and then you're going to take your left hand, which should be shoulder length apart, stretch like this, okay? So you're extending your shoulder, elbow, and wrist with this motion, okay? So let's go ahead and take your right hand here, and then with this arm, we're going to work on extending up. Okay. So it's probably going to be a lot for you to do 10 times and 10 reps 2 times. So we'll increase the amount of length here to about a shoulder width and a half. Now I'll try this motion. A little bit easier? Mm-hmm. Okay.
Do I touch my hand?
No, so we're primarily focusing on elbow extension.
Okay.
So you can we're only focused on this motion.
Okay.
And then coming back and relaxing. And then trying again. Yeah. Sorry, I just want to double check.
No, that's okay.
And then we're going to do your arm. Not going to do that one. And then we're going to do side to side. So we're going to do the exact same thing, except you're going to go to the side this time. Perfect. And then back in. So we're working on your shoulder, what we call abductors, just like that. Great job. Come back. And now we're going to do pull aparts. So you're going to start in the middle. You're going to pull this band apart, just like that. Great job. And then come back. And then one more time. Good. And now we're going to more focus on specifically the elbow. So we're going to work on straightening. So since we're going to work on your left, you're going to keep this arm about right here. And oops, so sorry.
No, you're fine.
And so you'll start bent, and then we'll go to a straightened. There you go. Yeah, sorry. That's best as so we'll hold this straight, and then we'll go into a. So it's kind of like the straight arm raise, except we're starting from a flex point and we're going to extension. Yep. Good. One more time. Great job. Okay, and then our last one's going to be wrist lifts. So this one's just going to be under your foot. Good job. So now you're going to hold this with your wrist. Okay. And you're going to practice wrist extension like that. So we can actually probably grab a little bit towards the end here. Give you a little bit more less resistance. There you go. Good job. We can kind of finish up with that. So that's basically what I'm looking for your upper extremity. So I'm really just focusing on your whole, your three main joints, your shoulder, with emphasis on your elbow and your wrist. Okay?
Mm-hmm.
And then if it ever gets too much, you can always increase the distance. However, I want the goal to be shoulder length.
Okay.
And now we're going to focus on, so this is going to go home with you, your lower extremity. So like I said, knee and ankle. So we're actually going to do a standing squat. Yeah. So we're going to put both of these, and then your husband can also be here to help you with this one.
Okay.
Because I know you're kind of unsteady on your feet right now.
Yes.
But we're working on that. So we're going to slide these under. And then these are going to be going into your hands like this. And so you're going to go from that position, and then so squat like that. So we're going to kind of go ahead and stand up. And now have you squat. Good. And up. And squat. So you're just using that resistance band to kind of help you pull your hips back down to your knees. Just like that. And then this will be the last one. Great job. So we're kind of the opposite here. Now we're working on bending these knees while we're working on extending your upper. Okay? And then we have our knee lift. This one's really cool. So I'll have you scoot forward in the chair if you can. Kind of, use the arm to push yourself forward. Great job. Now this is going to go under and then over like this. And you're going to hold this with your, let's say, your right hand. Okay. And now you're going to do knee lifts with each knee. Good. If you want more resistance, you always make it tighter, but that looks great. And then just alternate, yes. I'm doing 2 sets of 10. Just like all the others. And then just finish with this one, and we'll call that portion. Good. Great job. And then we have our second to last one. This is also a knee bender. So we're going to lift this around your ankle. And then it's going to come, and then we'll lift up your other foot. That's straight. And then you're going to grab this with your hand, and you're going to pull this knee back. Oh. Whoopsie. Weird. But great. You're doing good. Okay, and then we'll switch. And this foot. I'll grab that. So your husband can kind of help you with doing this too. Good. And then just do one more. Perfect. Okay, go ahead and release that. Slide this. Boom. Oh, so I got your shoe. Or your snake. And then our last one, which your husband will have to help you to do, is bending your ankle. So now we're going to extend your leg, and you're going to work on flexing. So I'm going to resist you like this, and then I want you to pull back like that. Okay? So try to pull back. Okay, relax. So yeah, just like a 1 second hold. Good. One more. Awesome. Great job. Now we'll do the other side. So now we're working on those ankle flexors. Okay, try to pull back. And I'll educate your husband on providing less resistance to let you do more reps as well, especially with these, because I want your ankles to be able to help you lift up your foot so you're able to walk around easier. Okay. And then that was the last one on that. So I'll go ahead and make sure that you have a copy of these, and then I'll make a second copy just so your husband has one too. More the merrier. But yeah, that's the program I'm looking at. Do you have any questions or concerns?
Not really, no.
Okay. Well, I'm going to jump into energy conservation, specifically around cooking, because that's where you want to get back to.
Yeah.
So the last item of business is going over your last assessment score, which was the modified Barthel Index. So that was the assessment for measuring your ADLs and seeing how good you are with them, your self-care, all that fun stuff. So while I'm going over this and scoring it with you, I'm also going to go over some energy conservation tips that you can implement to make these activities a little bit easier for you while we're strengthening with our home exercise program, so that it's easier for you to perform those activities, okay?
Okay.
Okay. So for your modified Barthel, you scored a 90 out of 100, which shows moderate dependence. You just received that score because you require a little bit of supervision because of your unsteadiness that has led those falls, such as your increased extensor tone, so your legs are sticking out more in your legs, and then the fatigue that comes with that, okay? So our first item here was our chair bed transfer. Excuse me. You just scored one below what perfect was. That's just primarily because you're a little unsteady with that transfer. So when we were going from the bed to the wheelchair, then back from the bed to the wheelchair, that's why I scored that. When we're increasing your strength with the home exercise program, that'll help a lot. But as like for some energy conservation techniques you can use is just taking some time beforehand, taking breaks. So, and also going in smaller movements. So when you turn, staying there, collecting your breath, and then do your next movement. And I saw that you used your hand, your good right hand, to pull up on your pant leg. That was awesome. That's perfect. You should definitely be doing that. But while we're increasing your strength, we'll work up to that, okay?
Okay.
So for your ambulation, that kind of goes with the same. It's going to come a lot with your getting rid of that spasticity in your lower legs. So if we can increase that, then get your score from 12 back up to 15. With a wheelchair, that kind of coincides as well. You were really using that right arm, which is a great strategy to use since that left goes a lot, contracts a lot with the increased motion. One additional thing, your posture, we want to make sure that, and I've marked all these, so like you kind of look over and bring them home with you.
Okay.
But with all three of these, if you have a more upright posture and you kind of focus on that, you're using less muscles, which leads to less fatigue, and so you can do more activities. So just something to keep in the back of your head. If you work on that posture, then you're going to be working less, okay? Okay, stair climbing. So on this one, you scored an A, which just like the others, you're one away from the best score, and that's probably because you're just a little unsteady because of how your legs are right now, and just your ability to move around. So one thing I would like to incorporate is taking more of those rest breaks, and then pacing yourself, allowing for time to do those tasks. So like working in the morning and then giving you some time in the afternoon to rest, okay? Toilet transfers, again, almost perfect. You scored an 8 instead of 12. And you're a little bit unsteady when you're going back, so just try not to be like hurry up to tasks, like slow down, take a deep breath, and just like reach back, and if you can't reach it, just get a little bit closer and then reach back again, okay? Bladder control, didn't have any problems there. Bathing, bowel and bladder, you had no problems there that you reported. Bathing, so I scored this a low or a 4 primarily because of you have a little bit of a sensation detection issue. So like with your left hand, when you went to touch that water under the faucet, you couldn't really test that change in temperature. With your right hand, you can just fine. And I made sure to test the water to make sure so you weren't posed at any risk. But for future reference, when you're cooking in the kitchen, or you're taking a shower, or just washing your hands, I would always lead with your right hand to make sure the water is an adequate temperature so you're not burning yourself.
Okay.
Okay? For personal hygiene, that was perfect. You demonstrated a lot of awesome energy conservation techniques, such as like leaning on the sink to allow like a load off the rest of your body so you can stand longer, and allow for that posture to kind of compensate. So that was great. And then feeding was also great. I would just again like work on that posture when you're sitting up, so like you don't have issues anywhere else. Okay. And then that's why your score was what it was. And honestly, that's a great score, and we can definitely get that up as well. Okay.
Perfect.
Cool. So as I was saying earlier with energy conservation and cooking, so I also have a printout here, and if you ever want to go back and look at this stuff, they're all right here for you to look, and using like adaptive equipment is a huge portion too. But for cooking, so and this can go for the other items as well. I just want to focus on cooking in general. But since you enjoy it so much, I want to make sure you have the best option possible to fulfill that task. So, like I said, doing things in the mornings, that's when you have your most energy, is awesome. So when you start working in the morning, you can start accomplishing more tasks. So let's say you get breakfast done. You can also start lunch, maybe even start dinner. So later in the day when you don't have as much energy, all those tasks are already knocked out. And then a huge portion that I should have mentioned a little bit earlier is just sitting down during these tasks. If you can relieve a lot of that, your legs, which is causing a lot of your fatigue, then you can have more energy, okay? So whether it be sitting down to get your clothes on or cooking, it'll just give you that extra energy, okay?
Perfect.
And then, preparing for time ahead, sitting, and using recipes that are quick and easy. There's a lot of cool new apps out there that, like 3-4 ingredient recipes, which would be awesome for you.
Yeah.
And then,
Sounds good.
I'd say so. I use them all the time. And then for like when you're done with your dishes, just letting them soak in the water so it limits the amount you have to scrub, and then letting them air dry, and you can reuse those as well. And as for like getting materials, getting them all together in one area, and so you don't have to keep making multiple trips. And I mean, that's a bunch of good energy conservation tips that you can use and implement, which I think will help your activities in cooking and dressing and bathing a lot. Okay?
Sounds good.
Cool. Do you have any questions for me?
I don't think so.
Okay, cool. That's it. Then you can take this with you.